Well, hormone replacement therapy is one of the treatments for women during menopause, but there are risks involved, which is why in a world-first trial, one Melbourne doctor is using acupuncture as an alternative. And as Georgia Main found out, it's already showing some promising results.
I'm going to put a couple of needles in the arms and a couple in the legs, and you'll feel mild discomfort, but that should be all.
An ancient therapy that could be the answer for an age-old problem.
We have had, good feedback from some women who've said that their hot flushes have completely stopped.
What started as a pilot study has gone global. Dr. Carolyn E. from Melbourne University heads up the world's largest study of menopausal women trialling acupuncture to treat hot flushes.
There have been two smaller studies, so of 30 women and of 50 women, and they had quite promising results. So that's why we went on to do a larger and much more conclusive study.
More than 100 women have so far undergone a course of 10 acupuncture sessions.
When you put the needles in, it stimulates nerves in the skin and muscle, and we think one of the main links to hot flushes is that the acupuncture increases the serotonin level in the body.
Around 2 million Australian women are going through or approaching menopause, when menstruation ends and the body's production of the hormones estrogen and progesterone drops off. About 80% will experience moderate or severe symptoms. The most common and most debilitating, hot flushes.
You feel like your core is heating up, and you feel like you could heat the room if you needed to.
After 4 years of suffering from severe hot flushes, 53-year-old Sandra Hutton jumped at the chance to be involved in the trial. Only halfway through her 8-week treatment, and there's already results.
You wouldn't think 6 little needles are going to do much. They're not as strong, and I'm definitely having less of them.
New research has shown that hot flushes persist for an average of 5.2 years, much longer than the 2 to 4 years previously reported.
Probably had them for about 6 or 7 years, I think. You do get a little bit desperate and start to grasp at anything just for the sake of good sleep. It's very embarrassing when perspiration is rolling down your face and down your neck and you're trying to carry on a conversation.
55-year-old Meredith Nolan finished her acupuncture sessions 2 months ago. The dreaded hot flushes all but went away.
I could have 16, 17 at least, upwards to 20 odd, and they probably dropped down to maybe 4 or 5.
And have the symptoms come back?
The hot flushes have gradually come back. Things are probably back to where they were at the time before I went to actually start the treatment. It tells me that it worked very well for me.
The most studied treatment is hormone replacement therapy, and that is the most effective for moderate to severe menopausal symptoms.
But after a 2002 US study claimed HRT dramatically increased the risk of heart disease, stroke, breast cancer and blood clots, women around the world were scared off the treatment. But despite a major review recently declaring HRT safe, many women like Sandra and Meredith are still sceptical. Dr. Elizabeth Farrell from the Asia Pacific Menopause Federation says she's looking forward to seeing if acupuncture really could be an alternative treatment.
There are a group of women in whom we cannot use hormone therapy. For example, women who've had breast cancer. So to find a therapy that actually will improve their symptoms that is non-hormonal will be really wonderful.
But to find out for sure, another 280 volunteers are needed.
So that they can find out if it works, and it can hopefully help a lot of women out there. So if I'm one little increment in that, I'm happy.
I hope that at the end of this we'll be able to say to women that, look, here is a treatment for you that is effective and it's safe and it's going to help you.
And you can go to our website for more information.